Hello, guys. Hope you're all okay. You're all enjoying your life. And welcome back to Dr. Arshad Nadeem Awan ultrasound and radiology teaching video. I'm going to start about the brain tumors. In previous videos, I have discussed about the CT brain anatomy. I have discussed at length about the vascular territory, and I have also discussed about the different types of strokes, including ischemic stroke and hemorrhagic stroke. Now, today I'm going to start about the intracranial tumors. Intracranial tumors are divided into two main categories. These are intraaxial tumor and extraaxial tumor. Intraaxial tumors are also called as glioma. It's a big category, and it includes astrocytoma, it includes dendroglioma, and also include ependymoma. So far, the extraaxial tumors are concerned, it includes meningioma, hemangiopericytoma, neurofibroma, schwannoma, and choroid plexus, papilloma. All these are extraaxial tumor. The main indicator for the diagnosis of the brain tumors are the age group and the location. See, these two are very important. Like mostly in pediatric tumor, it would be I would say infratentorial, and commonly in the adult or young age group, you will see that the supratentorial tumors would be common. So there are certain age group, there are certain areas, so all this will be included. Beside this, in this lecture I'm going to talk about the radiation necrosis as well. So all these points are included in that video. So just have a look and make a first layer of knowledge, and on the basis of that we will start discussing one by one. Like we'll discuss the astrocytoma and ependymoma and dendro glioma. All these would be included that, but step by step. This video would be a first layer of knowledge. Just get an idea about that intraaxial tumor and extraaxial tumor, and then we will discuss ahead. So let's start watching this video. Intraaxial tumors are those which are arising from the brain parenchyma, and mainly the nomenclature which has been given to the intraaxial tumors are the glioma. These are the broad, it's a broad category, and it include astrocytoma, which is arising from the astrocytes, oligodendroglioma, it arises from the oligodendrites, and it also called as an ependymoma. It also arises from the ependymal cell. So in generally these are all called as a glioma. As far as the extraaxial tumors are concerned, the tumor which are arising from the tissues that covers the brain, and that include dura mater or arachnoid mater. These tumors would be called as an extraaxial tumor, which involves either the dura mater or it involves the arachnoid mater. So for the extraaxial tumors are concerned, it's frequently involves in adults, it involves the adults as compared to children's, while intracranial tumor or intraaxial tumors happens to be in both in adults and in the children same. But so for the frequency of the extraaxial tumors are concerned, it can be usually seen in the adult age group. So normally if we look for the extraaxial tumor and their origin, so the first extraaxial would be the very common one, meningioma, and that is a meningothelial arachnoid cell would be responsible for that. Hemangiopericytoma, that would be mesenchymal pericytes. Schwannoma and neurofibroma is usually seen arising from the cranial nerves. The epidermoid and dermoid cysts, these are actually developmental cysts. These are tumor-like lesions. So far the choroid plexus papilloma are concerned, it arises from the choroid plexus. So these are all the extraaxial tumor, while intracranial tumors are classified according to the WHO classification, which we are going to discuss later. According to the WHO classification, intracranial tumors are classified into different grades. If we take the example of the astrocytoma, it is divided into grade 1, that would be benign, or it is pilocytic astrocytoma. Grade 2 would be a diffuse astrocytoma. Grade 3 would be anaplastic astrocytoma, and grade 4 would be glioblastoma multiformes. On the video of while I'll be discussing astrocytoma, I'll explain each and every category of the WHO classification regarding the grade. Another important point worth noting is that the patient age and the tumor site is a very useful indicator for the diagnosis of the tumor type. So some tumors happens to be in certain age and some particular tumor having a particular site. Primary tumors in the children are usually seen in infratentorially and in posterior fossa, and that is ranging from 2 to 10 years of life. And the common one is pilocytic astrocytoma. You may be able to see pontine glioma, ependymoma, and medulloblastoma are the common tumor of the children in posterior fossa. Below the age 2 and above the age 10, supratentorial tumors, pediatric tumors affects the midline structure. So if it is less than 2 years of age or above 10 years of age, these are happens to be a supratentorial, and pediatric tumor mostly commonly affect the midline structures. Astrocytoma is the most common primary tumor of the childhood tumor. Majority are pilocytic astrocytoma, and it involves the cerebellum. You may be able to see in hypothalamus, and you will also be seen in the optic nerve, like this would be an optic nerve glioma, and actually this would be pilocytic astrocytoma. Usually you can appreciate this on the MR images quite clearly. One another point worth noting is that in adults 70% intracranial tumors are primary, and only 30% would be a metastatic deposits. Vast majorities are supratentorial. Posterior fossa is very rarely affected by the primary malignancy, primary tumors in the adult. Late complication of the radiotherapy or gamma knife surgery would be seen in the radiation necrosis, and it present as an enhancing mass lesion, which is difficult to diagnose whether it is recurrence or this is what the radiation necrosis. So it's quite difficult to distinguish between these both. A bird eye view has been given for the intracranial tumors, and further divided into intraaxial tumors and extraaxial tumor. Beside this, we have also discussed about what are the commonest tumors in the children and what are the commonest tumors in adults, which sites are responsible for which type of a tumor, and beside radiation necrosis has already been discussed. So further step by step these tumor has been already uploaded in different and separate sections. Intraaxial tumor has been discussed separately with everyone in a single video, and extraaxial tumor has already been discussed with a particular video. So just keep watching all these videos, but before going to watch that video, first watch this one to just make you realize how many types of tumors are there. So with some other videos we'll see each other. Till then, take great care of yourself. Bye bye.